Foundation board members that are present. And I also recognize all FAJIM scholars here on this call. My name is Toiba, and I am deeply honored to be making an introduction of the FAJIM Medicare Foundation. So FAJIM is a non-profit, a non-political organization that is established in 2018, and FAJIM is committed actually to improving healthcare access and empowering future health leaders through free medical outreaches, community health educations, scholarships, mentorship programs for medical and allied health students. And since the inception of FAJIM, the achievements recorded are 8,570 free health screenings, 2,953 free treatments, 175 scholarships for medical undergraduates, and 27 extramural lesson sponsorships. Thank you so much.
Thank you, Toiba, for that introduction. Okay, so we can go ahead to start. So far this year, we've had sessions on time management, effective study habits, career path in health sciences and health entrepreneurship. We hope that these sessions have been impactful and inspiring for your journey as future healthcare professionals. Today, we are going to be talking about a topic that is essential for every medical student, maintaining mental health and well-being. We know that medical school is rewarding, but it can also be stressful and overwhelming. So learning to manage stress and maintaining mental well-being is essential for both your success and your long-term health. That's why we are thrilled to have Dr. Mustafa Sanbe with us, a distinguished psychologist, educator, and mental health advocate who will share practical strategies, insights, and guidance on maintaining mental and emotional health while navigating medical school. To formally introduce him, I would invite Bemisola Tofumi, a nursing student at the University of Ibadan, to read Dr. Sombe's bio. Tofumi, you can go ahead, please, if you're here with us.
Good evening, everyone. Can we hear me, please?
Yes.
Evening. I can hear you, Sophie.
Thank you very much. I'm Bimsola Tofume, a 411 nursing student and an an awardee of this foundation. So it's a pleasure to read the citation of our honorable guest today, Dr.
We lost you, Tofumi. Are you still here? Tofumi.
Maybe someone could get in touch with her on direct call. She might think we are hearing.
Okay. We lost her.
Certainly not on WhatsApp call.
I'll just read the bio. Okay. So
I can go
Doctor.
ahead to read it if you allow
Okay,
me.
please do. You can. Thank you.
Thank you, man. I'm Sheridin Rabiu, a medical student from Ladoke Akintola University. So I'm glad to read the bio of our guest. So professional bio, Dr. M.T. Sanbe, Dr. Mustafa Toyin Sanbe, PhD, fondly known as the Ebora of Psychology. He's a pioneering Nigerian academic clinical psychologist and educator. He earned his bachelor's in education from the Lagos State University, a master's in adolescent psychology and youth counseling from the University of Ibadan, and both an MPHIL and PhD in clinical health psychology from Obafemi Awolowo University, Ile-Ife. His research and publications, particularly in emotional intelligence, have made a significant impact on psychological practice and education in Nigeria. Dr. Sanbe's career spans teaching, clinical practice, and mentorship. He has served as pioneer principal of Iman College, University Counselor at LASU, and principal clinical psychologist at the Federal Neuropsychiatric Hospital, Yaba. Currently, he is a lecturer, head of the counseling unit, and director of sport at Summit University, Offa, where he leads programs that blend academic guidance with personal development, including participation in national sporting events like 2022 Nuga Games. Renowned for his Afrocentric and eclectic approach, Dr. Sanbe integrates cognitive behavioral therapy with African philosophy, focusing on emotional intelligence, anxiety, youth and family counseling, and resilience building. He has advised organizations such as ECOWAS during Nigeria's Ebola crisis and Nigeria Leadership Initiative after the Dana air crash. And he continues to mentor young psychologists across Africa while contributing to media outlets as a psychological expert. As a respected professional and community leader, Dr. Sembe is a full member of CASN, NACP, and MPA, and the American Psychological Association, and has been honored with awards including Carson Fellowship nomination for 2024. Beyond his professional achievements, he is a dedicated educator, media voice, and family man who continues to inspire growth, healing, and empowerment in individuals and communities across Nigeria. So we welcome our guest to our midst. Thank you.
Thank you very much, Sheriff Dean. Dr. Sanbe, we are very honored to have you join us today, and we are excited to learn from your wealth of experience and wisdom. The floor is yours, sir.
I should like to thank you very much. Appreciate subtlety of tone and ambience of presentation mode since we have started. Permit me to give honor to whom it is due. I recognize the founder of FAJIM, Professor Abdulkarim, who has been a leader to me in my personal career, a pillar and supporter of the principle in whom shall go. I should like to register here that I am indeed very grateful for this privilege. This is not the first privilege that should to. Let's move on. The idea about this evening's interaction to me is to give the opportunity for all of us to learn and be ready to unlearn certain things. Then we can relearn certain elements of things that may be not absolutely strange to us, but presented in a different perspective to us. And finally, to establish the fact that learning goes beyond the four walls of the classroom setting. In other words, learning is a continuous exercise. The topic of today's interaction is maintaining mental health and well-being as a health student. Perhaps by extension, we can say as a health practitioner or potential health practitioner. I should like to sound a note of caution. Please let us try to give maximum concentration to this interaction and take a pencil, biro, and paper, and just have one thing to take away from this interaction. I am a psychologist, and psychology is about life and living. Psychology, I'll give you the opportunity to later after this interaction, search for divisions of psychology. At the last check, I had about 53 to 54 divisions of psychology. To that extent, That means psychology covers the lives of individuals from preconception to death and dying, or dying and death, which of course includes career. And that is why we have career division of psychology, industrial and organizational health psychology, from where we can see that this topic is very ingrained and falls squarely within the purview of what a psychologist of my leaning should be looking at. On top of that, I have conducted not less than 2 research works on psychological well-being. And that takes me to now letting us to consider certain elements, which I won't dwell so much on because I am addressing those who are supposed to have gotten into that, such as what is health. WHO has assisted us in defining health. And what is mental health? WHO has assisted us in defining that too. But it will be just interesting to gloss over such as health is a state of well-being, which include capacity to contribute productively to self and to the environment in which one is subsisting. Mental health deals with the capacity of an individual to, apart from what WHO is going to give us, which you can search for later, is about the capacity to have good judgment, to be conscious of self and one's environment, to have the capacity to maintain good relationships, not to be a burden to self or being a burden to the people in one's relationship circle. All of these are in my words. And if you are shopping for textbook definition, you may go ahead looking for that. But the essence, don't forget where we are coming from, that learning is a continuous exercise. And having another person looking at a construct or concept from another perspective, or making it homely or familiar, is not out of place, even when you are going to discuss what is this, what is that. That takes me to what is psychological well-being, or what is well-being. Well-being is that construct or concept that deals with the state of beingness of an individual, bordering on being well. And well-being can be viewed from 2 main perspectives: objective well-being and subjective well-being. Objective well-being is that well-being where one can objectively tick. For example, if one is in GS1, for example, it is expected that that individual should have the capacity to attempt basic elementary calculations, like 2 plus 2 is 4, 4 plus 4 is 8. And that individual feels, yes, I am able to do that. How to dress and dress properly to a reasonable extent, yes, an individual in GSS1 should be able to take his bath or her bath, take personal hygiene and do it very well, and so on and so forth. If an adult, maybe around 45 years by our own age classification, the individual should have gotten a degree at least. It's not generally true that everybody must have gotten a degree at that age. We are looking at objective psychological well-being. If that person has not gotten a degree, then we look at it as, oh, But is that individual married? Objectively, you look at it and you get a tick. But can you say that person is happy? One may be married, one may have a degree, one may have a good job. All of these are objective psychological well-being indices, but one may not be happy, which is a subjective psychological well-being construct. Subjective psychological well-being is that personal feelings or mental state that gives one the satisfaction that at this my age and time and my calculation of being alive and well and making progress, I have gotten a degree. I am happy with my marriage, or I am happy not being married. There are 1,001 people who are in marriage and not happy. That is another different kettle of fish, where we are looking at subjective psychological well-being. An individual might be happy not having a degree and compensating that, yes, I have PhD working for me. Just as certain individuals in our community who is very rich, who has no PhD, who is having the best refinery in Africa or so, but is happy that he's making money, is influential, and he has plenty PhDs applying to work under him. He's happy that he has no accommodation or facility or property in London, but his employees are having such facility or holdings or investment at international levels. Meanwhile, another person might have less than that, but still be bothered about not having this and that at international level. So there is a ding-dong. Some people will think, I will prefer objective well-being. Or another person can say, I will prefer subjective well-being. But what we're looking at in a health state is to see how well that individual feels. In other words, as psychologists look at life and living, we individualize it. That is why we harp on individual differences. In other words, as somebody will be happy making a 50%, another person can be unhappy making a 70, because he or she may feel his target is making an 80 or 90. So these are dynamics of psychological well-being. Who is a health student? I don't think we should dwell so much on this, but allow me to say any student in any health-related program or course, such that maybe the individual can be in nursing, can be in medical laboratory, can be in clinical psychology, can be a specialist, either pediatrics or something, and so on and so on. So distinguished scholars, let me now let you understand the dynamics that it is not only the course of study in the health sciences that is challenging, but even throughout life, challenges will rear their heads. And that takes me to my gift to the world, which I have titled the 4 guiding points. And the 4 guiding points read as follows. 1, obey simple instruction. All instructions are simple. Either I'm now, maybe I should run through before now passing comments. 2, always get organized. because he who is not organized in time, with time, he or she is organizing a disorganized organization. 3, tell the truth always, no matter the condition. 4, make your own mistake and accept it when you are wrong. I take the explanation of the first one. Obey simple instruction. All instructions are simple. Every part of life and living is the process. And there is always a better way of doing the same thing. If you want to be ahead of your colleagues or be satisfied with yourself, having a stable state of well-being without transferring anger to somebody who is not offending or had not contributed to your negative mood or your mood swings, you need to appreciate and delineate boundaries. To that extent, between you and I, if you needed to go out, by going out, I mean formal going out. I'm sure you know that you need to, do your personal hygiene, take a shower, cut your nails if need be, get to the salon to do sisi koya or fine bobo, hairstyle and all of those. And then look at your clothing, iron and do well. It becomes even more critical as a health student. I'm taking exam is not sufficient for you to look tattered and haggard. If you can follow instructions and organize yourself. If you don't organize yourself, that is when you appear disorganized. And you even make it scary for anybody who is going to not only teach you, or the patient or client who is coming to see you. I challenge you that you go around seeing certain medical facilities that are touted as being expensive. Check out from the environment. You will yourself will say, it has to be. Because to maintain this environment, to be like this, cost good fortune. To that extent, like they say traditionally in Muslim circle, opopo moka moruru, àwọn cleaner abẹ wọn sùn ni, you know. To that extent, if an environment is to be clean and organized, there should be certain efforts that must be put into it. And that is what that second item is addressing. The third item is, haven't done your own. Sometimes things go wrong. It is dignifying and edifying for an individual to make a mistake and accept his or her mistake. And that is integrated into being honest with yourself and being true to one's environment or relationship partners. And that takes me to the dictum in medical environment that says, doctor, heal thyself. If you want to treat me, if you want me to heal, are you not going to cause any harm? Are you healed yourself? And that is the essence of before pre-operational preparations, where you need to sanitize and maybe make the environment not going to aggravate illness, but alleviate suffering. There will be, as soon as you are coming into a program, by a program I mean health program or courses or subject specialist area, you would have gotten your direction, call it curriculum, call it calendar. You would have been told what to do and what is the expectation. And if books are given to you as guide, don't just keep them, read. On top of it, for anybody to do well in the health environment, you should have an open mind and be a willing to read or learn person. And that was why I opened with, even this session is supposed to prepare you to learn new things. New things could be as simple as new word, new mode of presentation, new idea. And so unlearn your position that you previously had coming into this presentation. And then retool yourself by relearning another mode of doing the same thing. And then finally have an open mind that will give you the opportunity to continue to add and delete. Above all, you need to recognize the fact that no man is an island entirely, or no woman is an island entirely unto himself or herself. We all need somebody to lean on. And so choose wisely your relationship, either study relationship partners, family members, and use the facilities that are available to enhance your academic performance or professional performance. Just as in each university today, I can tell you for free that the federal government, as at last year, released 100 million each to all federal and state universities of whatever nomenclature to service counseling and career centers. And as scholars, you calculate that by either multiplying the institutions at that level, how much that should have been. Even 100 million for your institution, you should have a benefit. As a human being, you will have certain concerns. As a psychologist and university counselor, I know that most students who underperform are not necessarily having low intelligence or have poor capacity to read and retain, but circumstances sometimes beyond their control or even inflicted by themselves, such as a feeling that my friend has more friends than me, can lead a student to become a poor performer. My student has more money, my classmate has more money to spend than me. If that impinge in the cognitive processes of an individual, it can lead to cognitive distortion, which will require cognitive restructuring if the individual could be assisted to get to the counseling unit. Inadequate funding, late payment of school fees, and so on and so on. I guess FAJIM should be filling in the gap by way of providing scholarships and mentorship program as we're doing this evening. I would rather want to hear from the scholars more than me shopping for taking the 30 minutes that is given to me or her. So at this stage, I want to thank you for your time and open to questions. And before then, just let me tell you that everybody has one thing or the other agitating one's mind, requesting or desiring of information. I give you a quick one. When I was much younger, I challenged my father, "Sir, why are you having so many calves? How many will you wear at a time?" And my father told me, "Don't worry, just pray." At this stage, I was in primary school. So just pray that you become successful as a man. You will now understand why. And I can tell you for free that these days, even the program or the occasion that I won't go, some of my friends would have even asked for my size of cap and made it for me, and they will send it to me by courier. So these are issues. I give you another quick one. When I was a child in primary school, I asked my father, this pen that you bought for me is so cheap, because I was seeing that of a tenant or neighbor who I assumed that the parents are not as rich as mine, having more expensive writing materials. I went to my dad again and he told me, is it writing? I said, yes, sir. Go and write. If you pass well, use your own personal money to buy the expensive pens that you want. I want to thank you for your time and attention. Thank you.
Thank you so much, Dr. Sanbe, for that very insightful presentation. A few key points we can take away from today's lecture. That mental health is the ability to stay aware of yourself and your environment, make good judgments, and live in a way that doesn't harm you or those around you. Well-being is your overall state of being well, seen through two lenses: objective well-being and subjective well-being. He also shared 4 guiding principles to help us stay grounded. Follow simple instructions, stay organized, always tell the truth no matter the situation, own your mistakes, and accept when you're wrong. These reminders show us that protecting your mental health doesn't always require big steps, but consistent, honest, and organized living can make all the difference. All right. Thank you so much, Dr. Sombe. Scholars, this is your opportunity to ask questions, share your thoughts. You can unmute yourself or type in the chat box. Yeah, please, as interactive as possible. But before then, if Professor Abdulkarim wants to share comments, I think she can go ahead now. Prof. Ma.
All right. Thank you very much, Dr. Sanbe, for the lecture. Dear scholars, so if we look at the topic again, it is, I would say that how do you stay sane, in spite of all the stress that you go through as students. It's either you have to go to lecture, or you are preparing for in-course exam, or if you're or you're going for one attachment or internship, or you have to go to the ward to take history, examine your patients and prepare ahead of ward round. Meanwhile, you have in-course exam to do as well, and you have assignments to do. And then we have some of you who have to fend for themselves. Okay, I know that we have a lot of that now. Talk to some students, they're not doing well, and they tell you, "Man, I have to go and they do all sorts of things, in town to sustain themselves." I have something on my table now, a student who was not able to register, before the portal closed, and so could not do exam. So if I can ask Dr. Sanbe to address some of this issue, how will such a student not break down? And then what can they also do? Because you, in the process, you see someone, you have a case in question like that, and you have a friend who will say, how are you doing it? I will say, oh, you are too serious. Come with me, Joe. And he takes him somewhere and introduces him to all sorts of things. And then he gets hooked. Okay? How should they stay sane in spite of all of this? What are they supposed to do to continue to remain mentally okay? How should they uh, stay cool and calm in spite of all the stress that they undergo as students?
Thank you. Thank you, ma'am. I'll start with the issue of that person who did not register on time. I had a similar case when I was a university counselor in Lasso. The young man had gone to Port Harcourt to do conductor job to be able to pay the school fees. And he came only about 4 days to the close of the porter. Unfortunately, out of anger, most probably, the person in charge of the porter made the head of the computer or ICT unit to impute on the guy's form that coming 2 or 3 days to the close of anything. To cut the long story short, I took it up and I went to the legal officer of the university and said, we are going to look into a case and we have to be very careful because if we don't treat this case on its merit, suppose an individual gets to the street of Lagos Badagry Expressway and carries a gun or cutlass, and all he needed to do was to ask question, where do you work? And if you say Lasso, bah, then they will now say there is one madman on Lagos Badagry Expressway who kills only Lasso staff. That ideally the legal concern should be on or before the date of expiry. To cut the long story short, the chartered accountant today is in London and is in practice. What is important in these circumstances of people coming up with these issues like this is because they are not using the facility available to them or facilities available to them. Like Yoruba Afrocentric philosophy will put it that mi ò rí kíní rí, ẹ̀rù la fi ń dàbọ̀ lọ́rọ̀. Or making yourself feel that whatever you are going through is peculiar to you and personal and nobody can ever have idea about it is sheer being delusional. One should use the facilities, the facilities, I mean, including human and non-human opportunities to navigate through life puzzles. For example, now, Adeseun Adegoke, what is your field? Is he online or is not there? Kayode Adelere, are you there?
Good evening, sir. I am there, sir.
Who is addressing me now? Is it Kayode or Seun?
My name is Adelere Kayode, sir.
Okay. Now, what is your own major challenge? What is your area of study? I'm trying to bring a case up, Prof. Ma.
Okay, sir.
We are listening to you, yes. Thank you, ma'am.
Okay, sir. I am a medical student, sir, at FUTA, Federal University of Technology.
Yes, Yes.
So my challenges are probably the bulkiness of the exams and how to navigate and balance everything. So because the
What,
system they are using at school is
what do you think is the demand? Do you have the financial support to do as much, maybe at 50% of what you are doing?
okay, sir. Yeah, the
Yes, let's take it for yes, Abi. I don't want to assume, but I don't want our time to slip by.
okay, sir. So the
Coyote,
financial,
be forthcoming.
sir.
Be forthcoming. Come up quickly.
Okay. Financial challenge is part of the major challenge, sir. For example, now where I am staying to my school, the place is kind of far. So uh, before I get home and try to relax and read my book, so time would have gone already. So unlike someone that has money uh, to take an hostel nearby to school, so where the
Thank
person can
you.
just
Thank
enter.
you, Coyote. I now tie that to time management. Do you agree with that?
Yes, sir.
Very good. And so, apart from the time management and your financial linkages, have you taken any attempt? What level are you now?
I am in 300 level, sir.
300 level. Very well. Have you visited your university counseling unit at all?
I usually go there, but for another purpose, sir. Not
Okay, give an example of purpose. If it is not too personal, you can give it. But if you think it is too personal, leave it. Which one?
no, maybe for example, now I help the mental health organization in my department. So
Okay.
for people in my department which may be having one or two challenges,
Very
so that
good.
they can
And
help them.
that is okay. Káyọ̀dé,
Yes,
ibi
sir.
tí èèyàn bá ti ń wo lókùnrùn, èèyàn máa ń wo rẹ̀ ni. And that is why those are forerunners in health. They said, doctor, heal thyself. You could have taken on the counselors and say, I am staying at this place. How can I be helped to stay at so place that will give me this and that opportunity? Thank God that you have identified that you are already useful to the community, but you need to be useful to yourself too. Can you see that? Or it doesn't make sense to you?
It does, sir. It does, sir. Yes, sir.
Are you going to take a step maybe by tomorrow by moving on to that? And through a prof, you can send me your telephone number, then we can take it up. Okay? So that at least know that at least you are here and you have benefited. So thank you, Prof. Can I ask Agbola Mubarak any question if he's not going to ask me questions?
Good evening, sir.
Good evening, Your Excellency, sir. Do you have any question?
I have no question, sir.
Better ask question, or otherwise I will ask you question. Thank you.
Thank you, sir. I have no questions.
You have no question. What can you say is your own takeaway in your own words, not necessarily copying my words or copying our moderators' words? What is your personal takeaway that you can relate to?
Oh, okay, sir. What I can say for now is, as you've discussed with us earlier about mental health, it's a very it's a very important and critical issue that one really needs to take as such. So I feel like whatever challenges a person is passing through, once someone is on the right track, then there should be hope that is going to pay off. So what I can take away is that with focus, with determination, resilience, and perseverance, that all
No,
obstacles.
I don't think I brought all of those in. I want you to relate to us. You know, Prof, one of the challenges of e-therapy is that people can be on electronically and be physically alienated. So at least from the microphone, I can hear background discussions. So I can imagine what level of distraction that Mubarak might have benefited from, to the extent that I expect that you should be telling us or talking to us about one particular thing. For example, I will expect, if you have been attentive here, to mention one word or two that is critical to your learning as a health student.
Hello, sir. I'm
Mubarak,
sorry. I'm sorry about that, sir.
let us move on. Don't worry, you have lost
one of
that
my
chance.
roommates. One of
It's
my
okay,
roommates
it's
is actually
okay.
in class. That's all.
Ayomide Gbadamosi, are we together? Ayomide Gbadamosi, Badejo Samuel, Badmus Basit, Barakat Akinyemi,
Barak
George.
actually has a question on the chat box, and Mujib
Okay.
also has a question. Maybe you should ask those questions while you.
Yeah. I can see it. I think maybe the moderator should help me to
Okay.
read
Maria,
it
can
out
you?
so that
Yes, I would help you read it out. So Mujib is asking, what tips do you have, sir, for students who are not trying to rely only on medicine in their professional career? And how do we cope with trying to learn new things if we don't have someone to put us through effectively?
Thank you very much. Let me quickly answer that.
Okay.
If you seek, you will find. If you seek, you will find. If you ask questions, you will have solutions. And like I keep telling even adults, that we all need someone to lean on. And classically in Yoruba psychophilosophy, it states that Ola ko yaboro ta bare ni bala. If not for Professor Abdul Karim, probably I wouldn't be privileged to be on this platform. And it was somebody who facilitated my meeting her at one time or the other. So it becomes a chain reaction. I don't know if I am able to make sense to you, Mariam.
Yes, sir,
Hello?
definitely.
So perhaps maybe you may restate what sense you are, so that at least you can get it right. Thank you. Mariam, over to you. Hello?
Hello.
Hello?
Yeah.
Yeah.
Mujib
Or
is asking
maybe,
for tips
Ma?
on how
So,
to.
can you hear me, sir?
Oh, okay. You were muted, Mariam. We didn't hear
Yeah,
you.
Mujib is asking for tips for students who are not trying to rely only on medicine.
That's what I have just said. I said ask.
Yeah,
You
okay,
ask.
yes.
And let me tell you, the beautiful thing about life is there is someone somewhere who is waiting to offer help. But if you don't initiate it, it's just like we are talking about referral in health services. If you don't go to one person who will see his own limitation in attending to you, you won't have the opportunity of being referred to someone who will provide adequate and appropriate treatment. Just like I think it's Chinese adage, the journey of 1,000 miles or kilometer starts with a single step. And the government of Nigeria has done a great deal of seeding 100 million to assist Nigerian students, in the universities, 75 each to state and federal institutions of polytechnic, 50 million each to all colleges of education throughout Nigeria, I'm telling you for free, to support career and counseling services. Prof, or do you have any contrary information, ma?
Well, I don't know, about the money, but I know that most universities have counseling units. And I was once the chair of within the student affairs, hostel management and all of that. But I know that a lot of students don't take the opportunity. They think it's only when you have major problems that you need to get to the counseling unit. They don't get, the counseling unit don't get enough patronage as far
That's
as
right.
experience will take me. And that can be one step, one major point that can come out of this
Thank
session,
you.
that our students should engage more with the counseling unit. Apart from that, there is no student that will come forward to any lecturer to say you want that lecturer's attention. You want somebody that you can talk to, somebody that will listen to, your issues. No, but I doubt if you go to any lecturer and the
Thank
lecturer
you.
will not be ready to
On
to
top of
treat
it,
you.
each level has a level advisor.
Yes, we have
Each,
advisors.
each department has heads of department.
Yes,
Each faculty has a dean,
sure.
and so on and so on. And if you are a student in good standing, even in one course or the other, you should have the capacity to approach your lecturer of interest or of fancy. All of these are not utilized by Nigerian students.
So,
So these are dynamics. Thank you so much, ma.
so
And
as
maybe, okay, ma,
we
sorry.
should like Mujib is asking. Yes, we have advised you severally at previous mentoring session that we should not be book alone, medicine alone. We should try to you know be holistic in our approach to issues. We should also learn other things. But you see, what I want to tell you is that in the process of trying to learn other things, you do not want to increase the burden that you already have as a medical student, or any students studying health related courses. The syllabus is enormous, and there is more and more content are being added by the day. Okay, what we had when we were medical students is it's almost like double of what you have now. Almost like what you have now. It's almost like double what we had in our days, because more and more, um, you know, uh, new new knowledge are coming out by the day. But then, as new knowledge are coming out, so are also new opportunities. You know, so are new opportunity. We didn't have AI, we didn't have Google, we didn't have internet. So you have all of this. Okay. So make use of all the things around you. Stay simple. Like one of the first principle that the guest lecturers, say simple, obey simple instruction. Don't concentrate on, other things for now. If you cannot cope, if you think you cannot cope, when you have so much to do, achieve this first. Get that certificate in your hand first, and then you can think of any other thing that you want to add to it. So, chew only what your mouth can take for now. Okay? Keep it
Maybe
simple.
by way.
And
Sorry. Okay.
the simple thing is study and pass first. That is priority. And everything comes to, your prioritizing, time management, and all of that. What is most important now? Face it. And other things can fall in
Yeah,
later on.
maybe by way of addition, I am aware that sometimes students get into programs that is not essentially their topmost interest area. For whatever reason, I think if you discuss that, we can find a way to navigate it. That's why psychologists harp on individual differences. Okay? Sometimes people might get information that are like not congruous with them, or some, yes, this is more like what I have been thinking. Instead of this, why not this? In all of this, you need to use best practices approach to resolving your concern. Okay. Then Akinyemi asked a question about people dismissing mental health concerns as attention-seeking behavior. Yes, I think maybe I will send to Prof who will share on your platform, which I believe you should have. Mental health concerns, sometimes even caregivers, mothers, fathers, siblings may not be able to put a finger on the behavioral change or maladaptive thoughts or behaviors. So some other people may label it anything outside of appropriate psychodiagnosis. It is only when the individual deteriorates sufficiently, almost to the point of embarrassment, before they are rushed to the hospital. But you that you know, you better help to seek kingdom. And that is why Lagos State House of Assembly passed a law on if you see something, say something, especially on mental health, that if anybody in the neighborhood has mental health concern and you know, and you do not help that person, you are equally liable. To what extent that is enforceable is a different ball game, but is a pointer that we need each other, or we need one another, or everybody needs somebody. Like I used to say during public presentation like this, that the psychologist needs a psychologist. The therapist needs a therapist. One of my seniors in Southern Grammar School asked a question: if the doctor is sick, who will now treat the doctor? I said the doctor needs a doctor, that even self-treatment is unethical.
Yeah.
So all of these are dynamics that we need to get.
Okay.
So don't fight anybody who doesn't understand the dynamics of mental health, because it doesn't make sense when you are arguing with somebody who doesn't know and you know. It won't show that you know. It will only degenerate that you don't know what you're talking about. Thank you, ma. I think you want to say
I
something.
saw one hand up earlier on. Is
Okay.
it?
I think Abdurrakib Ismail. Are you trying to say
Okay.
something? You can unmute yourself.
Good evening.
Yeah.
Good evening. Thank you so much for the session, Sam. Prof. Ma. So, I'm Abdulrahim Ismail. I'm a Lautech medical student. So currently we've been out of school for close to 4 months. And in fact, there's a particular class that have been out of school for about 7 months or so because the strike started their after they've been on break after their first professional exam. So this situation is mentally exhausting and
Challenge.
tiring because we are just the only one. It's not as if the whole school is on strike, it's just the medical students, and it's quite mentally exhausting. I'm quite sure that the question Oladosu Mujib is related because he's also a Lautech student and probably is trying to uh, explore some other things outside of medicine. So currently, it looks like there's no resumption in sight, and I just want to ask that how can we cope mentally with this current
What
situation that we
level
are?
are you? What level are you? What level are
I'm currently in 500 level.
you? In what level?
500.
500. Do you know that even after you're graduating from the medical school, there is still so much to learn? Do you know that?
Yes, sir.
And if that is it, why you should have your what is brochure, your academic time or course content of what you should be doing at a particular time at a particular time. Do you have it?
Yes, sir.
Have you read from where you are now to where you should be?
Okay. Answering that before the strike started, actually, my class we are preparing for our third professional exam. We are just a few weeks away from the exam. So when
Very
we
well.
started,
Well,
I was actually still trying to stay on track, preparing for the exam. But as it keep getting prolonged and looking
have you
like there's
heard
no
of
hope
this
of getting
word?
this time.
Have you heard of this word before? Initiative. Initiative. Have you
Yes,
heard
sir.
of that word before? What does it
Yes, sir.
mean to you? What does it mean to you?
Initiative is probably making attempts to do some things.
No, not absolutely. Not just, are you trying to do something under supervision? Is that initiative?
No,
Aha.
is
So now put it in perspective.
okay. It is attempting to do things out of one's own uh decision or without under no supervision.
It
Something
is
like
a capacity to initiate, to start something. Just like when they're saying, if nothing do you, do something. Have you heard of that statement before? If
yes, sir.
nothing do you, do something. Maybe that should be your own take home and a primer. Yoruba psychophilosopher will say, tí nǹkan ò bá ṣe ẹ́, ìwọ ṣe nǹkan. It doesn't make sense to you still. Hello?
Okay, Abdurraqib,
Yes, sir.
are you still in school or they sent
It's
you something?
but they are on break, maybe not
That's is strike.
orthodox break.
Is
Yeah, maybe
uh,
strike. So,
and ASU may also strike again. We don't
ah,
know. Yes, I
ah,
understand. I really do understand.
I
You
do too. Yes.
psychological effect it has on you, especially when you're supposed to be taking an exam and there is a strike action and several months after whatever you're even reading, there is no how that you'll be able to retain anything. But you see, what you can do is you can You can approach any of the. Do they send you out of the clinics?
Yes.
They have sent you out of the clinics.
Yes, ma.
Okay. And you are in 500 level. You have started going to clinic. You have just started doing clinicals, right?
Yes, ma.
You can approach any private clinic in town
Oh,
and say you want to come and be assisting. You want to
that's
do observership. Okay? If you introduce yourself, you're a student and you're out of school now, you want to come and be doing observership, and you will be assisting. Before you know it, you help them set drip, you help them do this and that, and you learn during their ward round and so on. Okay? That's one thing that you can do. Or you may even want to do something away from medicine. Start something that you can learn either online or in person, something that will keep you busy during this period so that you don't just burn away the time. Okay.
Hello.
Yeah.
Hello. Any other question? Can I ask Olaojo Jamiu?
Olaojo.
Olaojo Jamiu.
Yes, sir. I'm here, sir.
What concern has given you any mind-boggling time? Do you understand my question?
Okay,
Something
yes,
like,
sir.
okay, now then take it off from there. Thank you.
Okay, sir. Okay. I think my major concern now is as regards life after school. Do I really want to practice medicine? Do I want to do other things outside medicine? How do I make the decision to practice or not? I think that's my because I'm rounding up
Very
my
good.
my fifth year in medical school. We'll be in the sixth year by next year,
Very.
January or February. So
I get
we
that.
yeah.
What I would say to you is to thyself be true. Can
Okay, sir.
you say that again?
To thyself be true.
Then now convert it to myself. I should be true.
Okay. To
Say that.
myself, I should be true.
Let
To
me give you a
myself, I
classic
should be true.
example. Very good. You either
Okay,
say
sir.
the psychologist or counseling unit to do what we call personality tests. Okay? Personality
Okay. Yes, sir.
test and career interest inventory. Then let me now give you a
Okay,
classic
sir.
one in the name of Obada Poteju Osho. I'm sure Professor Abdul Karim will remember the person. He came into College of Medicine in Diaraba. He wasn't really interested in medicine, but because Mama wanted him to become a medical doctor because he has the mental capacity to be, he was heavily supported to be, but the young Dapo was interested in politics. And at every time that there is need for political representation within his zone, Mama has an authority within the zone
Yes, sir.
of nomination, and he will nominate his son. But the son still managed to graduate as a medical doctor. I'm sure if you're at the Ilupeju area, you will see Teju Osho Hospital there, if it has not collapsed. But Oba Teju Osho did not take it as a point of duty, but was interested in politics. By the grace of God today, he is the Oba of his domain, okay? Where, Oba is a political, spiritual, and whatever personnel in a community. because he was true to himself and was able to accommodate his being. He's able to satisfy objective and subjective psychological well-being. Did you go to College of Medicine? Yes. Are you interested in medicine as such? Not as such. What are you interested in post science? Have you been able to use your knowledge of going through the training of medicine to harness political capacity? Yes. Are you happy ultimately? Yes. Can you get that analysis?
Yes, sir.
So to thyself be true. And if you need help, seek help. I'm sure Prof will be able to adequately support you, or where she too will require to refer you, she will refer you. And
Yes.
I should like to say that all of us are lucky to still have our likes around who wants the young to grow. And that is what we are benefiting from. Thank you.
Thank you very much, sir.
Yeah.
Okay.
William Ogedegbe? Okay, sorry, madam. Sorry,
Yes,
ma'am.
I can summarize that to mean that you be true to yourself. Do you really have interest in practice of medicine? We have discussed some related topic in the past. Are you interested in practicing medicine, or are you interested in practicing in areas that are related to medicine but not really core medical practice of seeing patients? There are so many areas now
Oh,
you
yeah.
that you can go into that are not really about seeing patients. Especially most of you young guys believe that, oh, medicine now, there's no money in it, this and that. you know
Or it takes one
it's
out of
all
going
it's
to
all about
parties and all of that.
reading. Even after medical school, you still have to do residency. If the residency, you still have to, before they call you somebody, you have to continue to read. Even when you become a professor, it still does not end. So if you don't want that, you can look at other areas, because there are so many specialties
Shortly.
that are coming up now that are sort of assisting medicine rather than really practicing medicine. The area of
Maybe as a
AI,
corollary,
area of
just to
data
support you.
science.
Yeah.
Okay.
Just to support you, ma.
Yeah.
Not all lawyers go to court these days.
Yes.
Aha. So there are other areas in law that will still make you a lawyer and you get whatever you want without necessarily stepping into the courtroom even for one day if you don't choose to attend. I just want to quickly add that. Yes, ma'am.
Yes. So you don't have to practice. You can go and do masters in public health, and then you can
That's right.
get one WHO job, and yeah, or you do data science and be managing data, or you are a software engineer that is going to use your software to solve problems within the a lot of hospitals are taking up EMR now,
Yeah.
electronic data management and so on. So there's so many. So either you have to keep talking to somebody until when you get to that state that you yourself, when you get to the area that you think the your interest lies, it will click. So you
Yes.
continue to talk and continue to you know explore
So,
until you get to that destination that you have your mind will be satisfied. Okay.
Yes. Thank you very much, ma'am.
and that is why learning is continuous. Learning is a continuous exercise. So, and if your borderless learning makes more meaning and sense, So don't look at any learning opportunity as I better pass my neighbor. Thank you. William Ogedengbe. Is William around?
Yes, sir. Good afternoon, sir.
Good evening, Lawa, Olojoro, Konroshin, Sha. Okay now. So ask me question or I ask you question.
Sir, some of the questions I wanted to ask have already been answered
Okay, I
already,
will
so
ask
I
you
don't really have.
question. I will ask you a question. What do you think that FAJIM is doing well? Or how can FAJIM improve?
So concerning what I think FAJIM is doing well, the balance they create in terms of telling medical students how they can manage their time, how the other things they can do aside medicine, and like it's not just academics focused alone. So that's, I think, one of the things I like about what they are doing
Okay,
well.
how can what area of improvement do you want to see from FAJIM?
I would have to think about that. It's not something I can give at the spot.
How long have you been a beneficiary of FAJIM? Because we should
This
be
year, sir.
thinking of, you say, how many years?
I said this year, sir.
This year. Okay, you are forgiven. Just go and think about it, okay? So, Mariam, over to you.
All right. Thank you so much, Dr. Sanbe. We appreciate you for sharing your time, expertise, and guidance with us. Scholars, I hope today's session has given you practical strategies to navigate medical school with resilience. Remember what Dr. Sombe said. If you ever feel like you need help or support, always seek help. Okay, with that, we officially conclude today's session. Please don't forget to fill out the attendance form before leaving. Thank you all so much for participating. Have an amazing week ahead. Thank you.
How about vote of thanks from
Oh, okay, from
Prof?
Prof.
I
Prof, do
want to
you want
give
to?
Prof the
Prof.
opportunity to speak.
Yes,
There's
please.
someone who has
Prof.
given all of us the voice.
Yes.
All right.
I think it's an oversight. Please forgive
Yes,
Uh,
it
us.
was.
no,
Yes.
no, no problem. So, I want to thank Dr. Sambe for this session with our scholars. Um, uh, there are a lot of issues with the mental health, not only with students, but also even with staff. Everyone is going to the stage of what they call burnout. Okay, so as staff are going into burnout, so also are the students going into burnout because of the load of work. And the fact that we have jackpot syndrome now, the number of staff on ground is compared to what we used to have, is very, very lean. So even the lecturers, they are burnt out, so they don't have the time of students. So they just go to class, whether you understand or not. They download, and the students too, what do? A la cram, a la pour. They just want to cram and pass and go.
Yeah,
They say when we get there, when we are in front of the patient, we will know what to do.
that's
A-
right.
AI will tell us. But
Yeah,
practice is much more than that, because even patients are beginning to know their
right.
rights. So, at every point in time, I want to advise the students. You've been told that, make things simple. And the simplest thing is, if you have class, attend the class. I had a situation in my school with in one course that over 50% of students that did not make attendance. So you're you're in school to go to class. So go to class. Don't complicate. Already everything is complicated. The country is complicated. So don't complicate issues for yourself. Go to class when you are meant to be in class. Go for your practicals. Go for your clinic. So at least when you are in class, even if you don't write anything down, just listen. At least something, even if it is 20%, you will retain, and then you can read up later. So simplify things for yourself. Go to class, do what you're supposed to do at the right time. Manage your time very well. Okay? And I always say something. Jìyà pẹ́ kó má bàa jìyà pẹ́. That is, if you think, oh, you don't want to suffer now, you're only postponing it. So now is time to suffer. Now is time to work. And so when you work now, later on, there will be relief. There will be a later time that you have opportunity to decide, to choose what you want to do with your time. But now, the only thing that you want to do with your time is study, sleep, and play in between. And to be true to yourself means that if you are not coping, you have to speak out. If you are not coping, you must seek for help. Speak out. Speak to someone. Speak to a student. Speak to a teacher. Speak to your parents. Speak to someone. And when you speak to someone, you can take it off from there. Okay? And when you know you are making a mistake, it's better to accept and find a solution to it. So I want to thank you again, Dr. Sanbe, for the session you have held with our scholars today. And I pray that God will continue to be with you and, prosper you. Again, scholars, you know that in the next maybe 2 or 3 weeks, we're going to have another award ceremony for another cohort of students. You should try to attend, especially those of you who are still the beneficiaries of this scholarship. Thank you very much once again. Mariam, thank for the very well
I will
organized
share some things with you so
session.
that you can share with them. You know, I will share some things so that you
All
can
right.
share with. All right. Thank you. Have a nice time. Bye bye.
Okay, thank you, sir. Bye.
Bye.